I would like to tell you that this would be one of the more important sessions to watch for vitamin D. And I would request Yogesh ji to start off our session with the morning prayer, and then we can continue the discussion.
Okay, thank you, Dr. Meenakshi. Good morning, everybody. डॉक्टर के अग्रवाल सर की दिव्य आत्मा को नमन करते हुए आज हम फिर से ऋग्वेद के मंत्र से प्रार्थना करेंगे। ओम त्वमंग प्रशंसिषो देवाशविष्ठ मर्त्ययम् न त्वदन्यो मध्यवन्नस्ति मर्डितेन्द्र ब्रवीमि ते वचः। प्रभो, आप बलशाली सबसे, आप प्रशंसा योग्य सदा, विश्वदेव हे सब दाता, दुख विनाशक आप सदा, नहीं कहीं तुम सा सुखदाता, ध्यान आपका धरते हैं, प्रभु आपके वेद वचन का गान विश्व को करते हैं। धन्यवाद। ओवर टू डॉक्टर मीनाक्षी मैम।
Thank you, Yogesh ji, for that lovely prayer. We're just going to move on to our topic. So we are going to continue our discussion with vitamin D. And कल मैंने आपको बोला था कि जो vitamin D का immunomodulatory जो रोल है उसको आप डिटेल में डिस्कस करेंगे। इसके अलावा कुछ और पॉइंटर हैं which I would like to discuss today before मैं इसकी जो क्लिनिकल पिक्चर है और of the symptoms of deficiency and toxicity जो है ये मैं कल लेने वाली हूँ। So vitamin D के बारे में बात करते हैं। We had discussed yesterday that the deficiency would come in if the levels or serum levels of vitamin D are less than 20 nanogram per milliliter. आज इसके बारे में I will also discuss the different values इसमें. So there are two ways of saying this. तो आप कहीं पे देखे होंगे कि इसकी जो values उसमें लिखा होता है less than 30, कहीं लिखा होता है less than 12. So this you have to understand that there are different units that are in play, and they are reported both in nanomoles per liter as well as nanograms per liter. 1 nano इसमें के calculation है 1 nanomole per liter is equal to 0.4 nanogram per milliliter, and अगर हम उसको reverse देखें तो 1 nanogram per milliliter is equal to 2.5 nanomole per liter. So अगर लेस देन अगर हम नैनोग्राम पर मिलीलीटर से देखें, अभी देखिए अभी मैं जहां बात कर रही थी उसमें लेस देन 20 लिखा हुआ था, बट अगर हम देखें लेस देन 12 में दिस इज एसोसिएटेड विद रिकेट्स in infants and osteomalacia in adults. This is a very low level, and अगर हम 12 to 20 के रेंज में देखें, so this is generally considered inadequate. ये insufficiency हो गई. अगर 20 के ऊपर है, नैनोग्राम पर मिलीलीटर पे ही बात करते हैं, and this is considered adequate. And अगर 50 से ऊपर रहता है, then this is considered to be toxic. ये high levels रहते हैं. So this is one thing that I wanted to discuss क्योंकि ये confusion एक रहता है with regards to the units. Moving on, we discussed this yesterday. I just want to revise a couple of points because I think yesterday's presentation was slightly rushed. So for us to be able to utilize vitamin D, it has to undergo two processes within our body. जब हम vitamin D को अपने या तो sunlight के द्वारा या फिर हम अपने food sources के द्वारा food sources के द्वारा जब हम इसको लेते हैं तो it undergoes some changes in the liver and then in the kidney. तो अगर कहीं पे भी liver की problems आएंगी या फिर kidney की problems आएंगी, then there will be a problem in absorbing vitamin D. So एंड कन्वर्सली अगर हम बहुत ज्यादा विटामिन डी ले रहे हैं या बहुत ज्यादा विटामिन डी कंज्यूम कर रहे हैं, टॉक्सिक लेवल्स पे कंज्यूम कर रहे हैं, तो हमारे लिवर पे भी जोर पड़ेगा और किडनी पे भी जोर पड़ेगा। इस चीज का हमें खास ध्यान रखना है कि ये इसका पाथवे है फॉर इट टू बी यूटिलाइज्ड विद इन द बॉडी। So I had said yesterday that it maintains the calcium levels in the body. So vitamin D and calcium, they go hand in hand. They are best friends. And the levels of calcium are maintained by vitamin D as well. इसके अलावा it maintains the respiratory epithelium. मैं इसके बारे में अभी डिस्कस करूंगी. And it is an immunomodulatory factor. So moving on, this is the mechanism of how the calcium and the vitamin D levels are maintained in the body. So, when there is vitamin D in the body, then there is more of calcium reabsorption, so it increases. जब ये ज्यादा होता है तो ये calcium हमारी body में vitamin D जो है ये calcium हमारी body में वापस खींच लेता है. किडनी में अगर कोई calcium चला जाता है by means of the waste products, तो वो कैल्शियम हमारी बॉडी में वापस खींच लेता है. सिमिलरली जो अगर पेट से भी कैल्शियम को खींचने के लिए इंस्ट्रक्शन देते हैं विटामिन डी, एंड it promotes bone formation and growth. So इसमें भी ये कैल्शियम जो है रिलीज की इसमें मदद करता है. So as I said, जब विटामिन डी लेवल्स बढ़ेंगे तो कैल्शियम लेवल्स भी साथ में बढ़ते हैं. हमारे बॉडी के अंदर within the body, in the blood, the calcium levels will increase when there is adequate vitamin D in the body. अब हम आते हैं इस डिस्कशन पे which is a hot topic in COVID times, and that is vitamin D and its role on the immune function. So we have discussed many times, in fact sir has discussed many times on this platform कि जो हमारा एक immune response जो है to a foreign body, it can lead to two kind of responses. It can lead to a Th1 response or it can lead to a Th2 response. So I have a simpler diagram today that I wish to show you. Okay, maybe not so simple, but I'll try to explain it by means of this. So whenever there is an antigen presenting cell, there will be a TH. आप देखिए यहाँ से ये TH0 cell जो है ये it will either lead to a TH1 response or it will lead to a TH2 response. TH1 response जो है usually ये inflammatory response होता है, and जो there's a pro-inflammatory response, and the TH2 response is more of an anti. इसमें जो यहाँ पे जो cytokines यूज होते हैं they are not very inflammatory in nature. So आप देखिए TH1 में यहाँ पे interferon gamma का काम में आता है, and we all know that interferon gamma, GF beta, these are the ones that are causing the inflammatory crisis in COVID. ठीक है. And हमें क्या चाहिए? What do we need in COVID? We need that the antibodies are formed quickly, and जो हमारी जो memory है, जो B cell memory है, that हमारी जो immune system जो है, that is going towards the humoral immunity. क्योंकि जो cellular immunity है इसमें you've seen there are a lot of inflammatory cytokines that are in play. So what does vitamin D do? Vitamin D जो है ये TH0 को it moves it towards the TH2 pathway. So this is really important. So if this B cells and then B cell TH2 leads to B cells, and then B cells lead to the antibody formation. So in both of these processes are really important for any kind of for fighting any kind of infection. ये चीज हम याद रखें. But the problem with COVID that happened is that जो inflammatory crisis है ये बहुत ज्यादा ये पूरा हावी हो गया था, and it was causing a lot of problems in a lot of individuals. So if it was beneficial for us to move this pathway towards the TH2 pathway and then ultimately form antibodies. antibodies. So as I said, these two are both important, but vitamin D जो है इस पे जोर डाल के ये इसको इस तरफ ले जाता है and it ends up forming antibodies. This was the reason that we were giving vitamin D in a very high dose in the first few days of the illness. जब भी patient हमारे पास आ रहा था, we were giving them a vitamin D in a high dose so that this can move towards the Th2 pathway. So again, I will repeat that Th1 response important है and Th2 ऐसा नहीं है कि Th1 is absolutely bad. जब एक antigen आता है या फिर एक foreign body आती है, तो उसको inflammatory cell mediated immunity is also very important. It is important to sort of kill that antigen. लेकिन again inflammatory crisis ना हो, इसके लिए we want in COVID especially we wanted to move towards Th2. I hope this is clear. I'll go back to this diagram now. So you can see that यहाँ पे vitamin D जो है ये inhibit करता है Th1 and ये stimulate करता है Th2 response को. So Th17 and Th1 they go hand in hand and Th2 and Treg जो है this goes hand in hand. इसके अलावा innate immunity जो है ये this is the adaptive immunity arm and जो innate immunity है innate immunity is also helped by vitamin D. ठीक है, सो विटामिन डी जो है इनेट इम्यूनिटी में हेल्प करता है, अडेप्टिव इम्यूनिटी में Th2 रिस्पॉन्स लाने में मदद करता है. सो दिस इज द हॉट टॉपिक फॉर डिबेट nowadays and this is not a debate, this is a hot topic for discussion nowadays and this is what is going on. So I hope that this was clear. बहुत ज़्यादा details में मैं नहीं गई. I don't want to discuss all those cytokines and chemokines and confuse you because that is not the audience that we are catering to. So एकदम अगर हम समझें इसको कि यहाँ पे जो है cell mediated immunity आएगी, यहाँ पे antibody formation आएगा, हमें antibody formation हमें जल्द से जल्द इसमें करवाना है. So again vitamin D जो है ये there are these यहाँ पे innate immunity है. So innate immunity क्या है, जो एकदम naive immunity है. It is not a learned memory. कोई भी चीज foreign चीज आई, हमने देखा नहीं कि अच्छी है बुरी है, हमने उसको मारने की कोशिश करी. Innate immunity is that very naive and very innocent immunity that we have and इसमें there are these chemicals that are released in the body called catalycidins and ये जो है it is helped by, it is mediated by vitamin D. So इसका microbicidal effect जो है vitamin D का हम इसमें देख सकते हैं. Moving on, मैंने आपको बताया था respiratory epithelium में भी ये help करता है. So again, this is the same thing. This is another diagram showing the same thing जो मैंने आपको बताया कि inflammation जो है it will be caused by Th1 and Th2 जो है ये IL-10 and IL-4 these are the happy cytokines and these are the this is favorable and this is the inflammatory cytokines. So vitamin D जो है it gives a go ahead to the Th2 response. So moving on, I wanted to, what was I discussing? Respiratory epithelium. Okay, so the respiratory epithelium, it is helped by vitamin D. So आप देखिए कि these are the, मैंने आपको बताया कि जो कैथलिसिडिन्स हैं विटामिन डी प्रमोट्स देम. तो अगर आपके विटामिन डी के लेवल्स कम होंगे, कैथलिसिडिन भी कम होगा एंड माइक्रो अगर हम ट्यूबरकुलोसिस में देखें तब भी विटामिन डी का रोल इसमें अच्छा हमें दिखता है. एंड so catalycidins जो हैं these are helped by vitamin D. इसके अलावा if you have low vitamin D, you'll have an increased susceptibility to and severity of respiratory infections. Why is that? Because low vitamin D जब होएगा, chemokines बढ़ेंगे and the catalycidin जो है मैंने आपको बताया अभी ये कम हो जाएगा. So this will cause more of inflammation and it will cause damage to the airway epithelium and you will be more susceptible to infections and developing a severe infection. So इसके अलावा increased risk and severity of asthma can also be caused due to low vitamin D. सो इसमें क्या होता है, जब विटामिन डी लो है तो ये TH2 रिस्पॉन्स, ये जो IL-10 है, IL-10 इज दैट गुड cytokine that I talked about. So low vitamin D के चक्कर में there will be low IL-10 and this will cause decreased induction of the Tregs. तो मैंने आपको बताया Tregs are friends with vitamin D, and जब vitamin D कम होएगा तो ये भी कम हो जाएंगे, and इसकी वजह से हमारे D जो IL-10 है ये कम हो रहा है, and this will cause more increased risk, and it will cause the increased severity of asthma. So again, I said that there are several mechanisms by which, because of which we had taken this call of sort of promoting vitamin D in the COVID era. So I'll just go back to, I don't think ये TH2 and TH1 का response I need to discuss again, do I? I think we've discussed everything, so I'll just move on from here. So that was the respiratory. I think इसके बारे में काफी हमने बात कर ली है. So I think that suffice it to say that vitamin D has a good role as an immunomodulator, and it will help in the it will inhibit the pro-inflammatory pathways in the body. So again, COVID के बारे में अब बात नहीं करना चाहते हम. So I'll move on. So now let me move on to the next topic that I want to discuss today, and that is who are the people who are at increased risk of developing vitamin D deficiency. Okay, so breastfed infants, they are also susceptible. इसके अलावा older adults, they are at increased risk of developing vitamin D insufficiency, partly because the skin's ability to synthesize vitamin D declines with age. Skin में you all know that the sun is a good source of vitamin D, and लेकिन sun जब vitamin D हम ले लेते हैं उसमें, उसके बाद में there are certain processes that go on, first in the skin, then in the liver, then in the kidney. So all these functions are decreased in older adults, and that is why इनमें vitamin D की inadequacy हो सकती है. उसके अलावा जिन लोगों को लिमिटेड सन एक्सपोजर है, जो घर पे रहते हैं, लॉन्ग वर्किंग आवर्स होते हैं, या फिर कोई बहुत फुल स्लीव कपड़े उनको अपने ऑफिस में पहनने होते हैं, दे नॉट एक्सपोज टू द सन एट ऑल, जो ज्यादा हेड कवरिंग्स यूज करते हैं फॉर द पर्पस ऑफ for religious reasons. So you know that we have the Muslim population who are जो hijab पहनते हैं and they are fully covered. So उनको vitamin D जो है वो नहीं मिल पाता. So it is recommended that in their own household they can find a place where they can get exposed to some sun. So the people with limited sun exposure are susceptible to vitamin D deficiency. I'm getting a notification that I'm not being heard. Is my voice all right?
Yeah, it's fine.
Okay. So now again, this is something that I had discussed yesterday. People who have darker skin, so they have greater amounts of pigment, of this pigment called melanin in their bodies. And that will reduce the skin's ability to produce vitamin D from sunlight. तो जब हम sunlight इसको, जो मैंने आपको बताया कि skin का भी एक important role होता है, and this is why you have seen, I told you yesterday, almost 90% of the Indians are vitamin D deficient. So so African Americans, for example, they have much less African Americans staying in America, they have much lower levels of serum of vitamin D as compared to the white Americans who are staying in America. So again, as I said, because of the dark skin, ये जो हमारा एक conversion होता है skin के अंदर में, I think I did not stress upon that in this image. So यहाँ पे there is a conversion that happens here as well on the skin, and then it goes to the liver and then to the kidney. So there is, if you have too much melanin, dark-skinned individuals, they will be at a greater risk. people with conditions that limit fat absorption. So मैंने आपको बताया vitamin D. So vitamin A, vitamin D, vitamin E, and vitamin K. These four vitamins are fat soluble vitamins. And अगर आपके कोई भी एक ऐसी condition है, so there is a condition called cystic fibrosis, या फिर there is a condition, there are some problems with the liver, जिसमें आपका fat absorption जो है ये थोड़ा सा malfunction कर रहा है या फिर ये काम नहीं कर रहा, then your vitamin D absorption also will not be at par, and you will be at an increased risk of developing vitamin D deficiency. इसके अलावा गैस्ट्रिक बाईपास सर्जरी अगर आपकी हुई है, देन ऑल्सो यू विल बी विटामिन डी डिफिशिएंट. ओबीज इंडिविजुअल्स, तो मैंने आपको बताया था कि जो फैट सेल्स है ये ट्रैप कर लेते हैं विटामिन डी को, एंड वो हमारे सर्कुलेशन में नहीं रहने देते. सो ओबीज इंडिविजुअल्स आर ऑल्सो ससेप्टेबल टू developing vitamin D deficiency. These are the three slides that I wanted to discuss today. I hope that it's clear. इसके अलावा, so the last topic that I want to discuss today is the interactions with medicines. कल हम बात करेंगे about toxicity, about deficiency symptoms, and we'll talk about the food sources once more. Okay, food sources and what kind of doses we want to take. And then we'll take a question and answer session on Saturday. So I had said that I'll take it up in 3 sessions, but I've broken it down because कल वाला मुझे थोड़ा सा revision और करना था. And so okay, we are here with the interactions with medicines. This is another important thing that you need to know. So Orlistat, this is a drug, this is a weight loss drug. So अगर आप इसको लेते हैं, then you will this will reduce the absorption of vitamin D. And you should be having a discussion with your doctor regarding this. Statins आप अगर ले रहे हैं, तो statins will again this will reduce vitamin D synthesis. और इसके अलावा अगर आप बहुत high doses of vitamin D ले रहे हैं, then your statins might not be working as well. So this is one more thing that you need to be careful about. Your doctor will decide what kind of doses you need for both. Steroids के साथ में भी इसका interaction है, and these medications, they reduce calcium absorption and they impair vitamin D metabolism. So steroids also, they interfere with the vitamin D metabolism. इसके अलावा थायराइड डाययूरेटिक्स, तो अगर आप कोई हाइपरटेंशन की दवा ले रहे हैं और उसमें H नाम है, so then most likely you are consuming something that is containing thiazide. Hydrochlorothiazide के लिए H होता है, and any so this will also derange the vitamin D levels in the body. So इसके बारे में भी आपको ध्यान रखना है. So with this, I would like to end the session today. There are a few questions in the chat box. Is muscle pain also caused due to vitamin D deficiency? So muscle pain as such नहीं होगा, एक stiffness रहेगी, because of which you might get some sort of which might be caused due to the vitamin D deficiency. So remember, vitamin D and calcium, they go hand in hand. So vitamin D अगर कम है तो calcium भी हमारे most likely कम होगा, and this causes muscle stiffness. Muscles जो हैं वो जकड़न सी में होती है, and that might give you the perception of pain. भरत शर्मा जी कह रहे हैं, I have autoimmune hepatitis and vitamin D deficiency as well. Is it okay for me to take supplements of vitamin D, and what should be the quantity? How long can I take? So Bharat ji, the best person to advise you about this is the person who is treating you for the autoimmune hepatitis. But yes, most likely you can take, and इसका एक loading dose होता है. So I was going to discuss this in the question and answer session. क्यों हम इसको 60,000 units को लेते हैं? But I'll just briefly say. So 60,000 units जो per week हम लेते हैं, this is usually given for 8 weeks, and this is the loading dose. So this is given in the cases of deficiency, not insufficiency. It is given जहाँ पे severe deficiency होती है, वहाँ पे एक loading dose देते हैं, and then एक maintenance dose होता है of 60,000 units. per month. So that is what is usually given, Bharatji, but you would be required to speak to your doctor regarding this, or you can come and speak to us in the OPD and we'll help you. So it will be helpful if you can get your vitamin D and calcium levels checked before you come and see us. What is the role of vitamin D in strengthening the immune system in simple language? सिंपल लैंग्वेज में अगर मैं बोलूं तो विटामिन जो इम्यून सिस्टम है इसके दो आर्म्स होते हैं, एक इन्फ्लेमेटरी आर्म होता है और एक नॉन इन्फ्लेमेटरी आर्म होता है, विच इज द जो TH2 रिस्पॉन्स है, यूजुअली दिस वाज मेड फॉर पैरासाइट्स एंड सो जो TH1 रिस्पॉन्स है ये सेल के अंदर में जो कीटाणु होते हैं उनको मारने के लिए मदद करता है, और TH2 रिस्पॉन्स जो है सेल के बाहर जो होते हैं जैसे कि वर्म्स एंड उस तरह के जो एक्स्ट्रा सेल्युलर जो माइक्रोब्स होते हैं उसको माइक्रोब्स या फिर ऑर्गेनिजम्स होते हैं उसको मारने के लिए मदद करता है TH2 रिस्पॉन्स. सो इन वी नीड बोथ ऑफ देम. विटामिन डी जो है ये TH2 रिस्पॉन्स को सपोर्ट करता है और TH1 रिस्पॉन्स को निगेट करता है. सो इट इज अब आप वो समझिए विच डिपेंडिंग ऑन व्हाट काइंड ऑफ इलनेस यू हैव, विटामिन डी कैन हैव अ गुड रोल. श्रद्धा श्रीवास्तव जी कह रहे हैं, आई एम 45 years old woman, my vitamin D value is 63, is it sufficient? So it sounds good, and आपको you've not given me the units, so that would give me a better sort of understanding of this, but yes, it sounds sufficient. Anu Sharma ji कह रहे हैं, I had COVID in April last year, after that I had thyroid autoimmune problem, I'm pre-diabetic too, for a few days I'm having much knee and leg pain. In April last year नी एंड लेग पेन आपको अगर हो रहा है, वील हैव टू फाइंड द कॉज. अनु जी देखिए, यू नॉट इवन टोल्ड अस योर एज, सो विद एज दीज प्रॉब्लम्स कैन कम अबाउट, सो आई वुड रेकमेंड दैट यू स्टार्ट एक्सरसाइज एज वेल. विटामिन डी कैल्शियम के लेवल्स चेक करवा लीजिए, अगर कम है तब सप्लीमेंट ले सकते हैं. रजनीश जी कह रहे हैं, if anyone does not get enough sunlight, can it be supplemented by any other means? हाँ जी. So आप अपने if you are deficient vitamin D, अगर आपकी deficiency है, then you can consume the supplements on the instructions of your doctor. Can vitamin D be obtained from sunlight even after applying sunscreen cream on the body? So it is recommended that अपना अगर आप धूप में जा रहे हैं with the intention of taking in the sunlight and taking in vitamin D, तो आप अपना sunscreen जो है वो अपने ये सन एक्सपोजर के बाद में आप कंज्यूम करें. सो जो विटामिन डी है वो बहुत ज्यादा एफिशिएंट नहीं होगा इफ यू हैव अप्लाइड सनस्क्रीन. सो द डर्मेटोलॉजिकल सोसाइटीज जो हैं ये कहते हैं कि आपको आधा घंटा से ज्यादा आपको धूप में नहीं बैठना चाहिए. डू नॉट डू दैट बिकॉज दिस कैन लीड टू सर्टेन स्किन कैंसर्स. सो आधा घंटा ही आपको बैठना चाहिए इफ यू आर सिटिंग देयर इन द विद द इंटेंशन ऑफ बास्किंग इन द सन and taking in the vitamin D. आधा घंटा से ज्यादा नहीं करना चाहिए और उसके बाद में आप सनस्क्रीन लगा लें, so that can help you. At what time to take vitamin D? Any specific time and meal to be taken for better effect? हाँ जी, so आप इसको ले सकते हैं इन दूध के साथ भी लेने के लिए काफी जन कहते हैं. So you can take it in the you can take it at any time and with a meal. Vitamin D, रजनीश जी का सवाल है, vitamin D is responsible for arthritis. So as I said कि low vitamin D can cause low calcium levels in your body, and that can also it can cause osteoporosis, but arthritis directly it cannot cause. But yes, you need your bones to be healthy, and for that vitamin D can help you. My vitamin D is 15. Is it low? I feel weakness. Yes, Amit ji, आपका vitamin D it's sounding quite low. So please come and meet us, and we'll try to help you out with the dosing of the vitamin D supplementation. Do obese people double the vitamin D dose? So no. You need to come and speak to us. Obesity का different levels होते हैं, and then we'll try to help you out. आप इसका एक general answer हम नहीं दे पाएंगे. सो अनुपमा जी का सवाल है कि ऑटो इम्यून डिजीज में हेयर पैचेस हो गए हैं. सो विटामिन डी हैज अ गुड रोल इन द it helps your hair as well. So I don't think that the only cause is vitamin D. There is a multi इफेक्ट आपका जो ऑटोइम्यून डिजीज है उसकी वजह से ही आपको हेयर के पैचेस हो रहे हैं. एंड vitamin D supplementation, whether it can help or not, I would like to know कौन सी disease है, and then we'll try to discuss it. So on this note, I'd like to end the show today. Thank you everyone for joining in. A big thank you to Shwani ji and Mamji ji for bringing in the questions from Facebook and YouTube, and a big thank you to all those people asking those questions on Facebook and YouTube and on Zoom, so that the जो interest है वो बना रहता है. Thank you very much for joining in. We'll be back tomorrow with some more conversations about vitamin D.